Hello, my name is David Wolinksky from Cleveland Clinic, Florida. I am chair of the American Society of Nuclear Cardiology Appropriate Use Criteria Steering Committee, and I'm happy to welcome you to this ASNC initiative on Refer Wisely. Refer Wisely is a new educational program developed by ASNC to help primary care providers make better use of cardiac imaging tests, particularly nuclear cardiology. In response to the dramatic increase in utilization of cardiac imaging, societies including ACC, AHA, and ASNC have developed appropriate use criteria for cardiac testing. The AUC for myocardial perfusion imaging have been in existence for over a decade. Studies have shown that adherence to AUC can reduce utilization significantly without sacrificing cardiac outcomes or increasing the incidence of myocardial infarction. Unfortunately, the penetrance of these AUC into the referring primary care community has been inadequate. Clinicians are either totally unfamiliar with the existence of these AUC or have minimal understanding of how to employ them. Therefore, a large number of myocardial perfusion scans ordered by primary care providers are considered rarely appropriate. The high rate of rarely appropriate studies has increased the cost of testing, particularly increased downstream testing, and has caused insurers to limit access to testing even when appropriate. All of these factors has resulted in the decreased quality of care. In an effort to control spiraling cost of cardiac imaging, Congress passed the Patient Access to Medicare, or PAMA Act, in 2014. This mandates that, beginning January 2018, consultation with an approved clinical decision support tool embedded with appropriate use criteria be used before each and every advanced imaging study is ordered. Failure to use these tools will result in the imaging clinician not being paid for the study. Additionally, referring physicians felt to be outliers will, at minimum, be required to use prior authorization processes before testing is approved. Responding to a clear-cut need for further education, ASNC has partnered with the American College of Physicians to develop Refer Wisely, a multifaceted program to educate clinicians on the value of appropriate utilization of nuclear cardiology testing. AUC charts and tables can be cumbersome to understand and apply. Therefore, the focus of this program is to teach the clinician to appreciate the value of each and every test they order. Once this knowledge base is established, employing AUC will be much easier. We will have a variety of ways for you to learn. We are beginning with a series of 12 cases presented by ASNC experts that will teach the referring practitioner the value, or lack thereof, of specific cardiac tests in scenarios commonly experienced in a primary care setting. Following the presentations, representatives of the American College of Physicians will discuss the cases from a primary care perspective. All cases will be supported by references, and both audio and video will be archived on the ASNC AUC Corner website. This will be accessible from multiple primary care societies. The AUC Steering Committee has developed an opinion paper on the benefits of cooperating on adherence to appropriate use criteria. Hard copy AUC Made Easy resource guides will be distributed and will also be available online for reference. ASNC will be reaching out in person to primary care providers. We hope to have an ASNC AUC booth at national primary care meetings and support these efforts with live presentations at these meetings. We will monitor the effectiveness of our efforts by ongoing surveys of clinicians participating in Refer Wisely. We will modify content based on where the needs are greatest. ASNC believes that there is a wealth of information to be gained by participating in Refer Wisely. We hope you take advantage of all it has to offer. This information will make it easier for you to participate in mandatory AUC programs for imaging. Most importantly, it will lead to improved patient care and better outcomes. Thank you.